Welcome to the Institute for Government. I'm Gillian McRae, I'm Deputy Director here at the Institute, and welcome to the launch of the second edition of our Performance Tracker, a publication jointly between the Institute for Government and CIPFA, our dear colleagues at CIPFA. We have today a presentation of the actual report. My colleague Emily will be taking you through all the details of that, and our colleague Gillian from CIPFA will be taking us through some thoughts from international governments and international perspectives on some of that as well. We will be joined by Nicky Morgan, who is making her way here at this moment, so will be joining us very shortly. But we thought we'd start off and kick off with the presentation. Emily, do you want to take us away?
Hello everyone, can you hear me all right? Yes. Thank you very much for coming. Good afternoon. That's me. Okay. Philip Hammond is by reputation a man after our own heart here at the Institute and at CIPFA, for the simple reason that we all love a good spreadsheet. In this, our second edition of Performance Tracker, we've analysed over 100 data series across 9 different public services to give a consistent high-level account of their performance. Now, that's still not all of them, but before you go running for the door, don't panic. Over the next 15 minutes or so, I'm going to refer to only about 15 of them. If you want to know about the other 85, you can read the report. Our judgment is that the government has become trapped in a reactive spending cycle, missing warning signs, allowing problems to mount, and responding to operational or political crises with emergency cash injections. Now, we estimate that the government is currently spending more than £10 billion over 5 years in this way. Now, that number includes things like the £1.3 billion for schools that was found from elsewhere in DfE's budget this July, and the £500 million of extra resources that were found for prisons this time last year. Now, these are not investments. This extra money is being used to keep services going in their current state, not to solve the underlying problems which allowed those pressures to build up in the first place. And in too many cases, the government lacks a clear strategy for what will happen when the money runs out. Without action to change the trajectory that some of these services are on, the government will remain trapped in this reactive cycle, spending more money than it originally planned, but without seeing services improve. That's why we're calling on government to improve the way it makes spending decisions, by subjecting the assumptions underpinning them to independent scrutiny. Now, we've expanded our analysis in this, our second edition of PT, adding 4 key public services to the ones we first covered in the spring. So we've added GPs to our chapter on health and social care, which also includes hospitals and adult social care. And anyone who's seen me speak before will know I absolutely loathe all stock images of social care, so that is a picture of me and my nan. We've added criminal courts to our law and order chapter alongside the police and prisons. We've continued our analysis of schools. We've added a chapter on neighbourhood services, so things like bin collection, road maintenance and trading standards that are delivered at a local level and make a big impact to the environment that people live in. And finally, we've added a chapter on UK visas and immigration to begin our tracking of Brexit-facing public services. So, what's the story? We're now into our third Parliament of Fiscal Consolidation, which began all the way back in 2010 with these guys, when the coalition set out to control spending on services as a means of reducing the deficit. Now, there's a range of different ways that the government can control spending on services. They can decide to reduce the scope of a service they provide. So, for example, using sentencing reform to shrink the prison population, or by rationing access to certain health services. They can also abandon certain performance targets and allow the quality of services to fall. But for the most part, the coalition decided they didn't want to do this. They pledged to control spending whilst maintaining or even expanding and improving the scope and quality of services. And our analysis suggests that they were initially successful. There are clear signs in the data of efficiencies across services in this early period. Broadly speaking, government really did manage to control spending and maintain quality up to around 2013-14. However, by and large, this wasn't achieved by long-term transformational reforms to the way these services operate, making better use of technology, for example, or improving the interface between services. Instead, they relied on short-term belt-tightening measures like wage freezes and staff cuts. And midway through that parliament, the pressure started to bite in areas where the belt-tightening approach proved insufficient. That's when things like hospital waiting times and prison violence started to creep up. Now, in 2015, these guys got rid of their third wheel, but continued with the same strategy. In the 2015 spending review, the settlements laid out by George Osborne implied a reduction in day-to-day government spending of over £10 billion between 2015-16 and 19-20. And now, our new government remains committed to implementing those spending reductions, whilst also delivering, to quote the Conservative manifesto, world-class public services. But 2017 is a very different world from 2010. The failure of these governments to make a success of more transformative changes or to make explicit national decisions regarding the quality and scope of services have drastically limited Philip Hammond's room for manoeuvre and trapped this government in a reactive spending cycle. Now, making large-scale changes and driving politically challenging reforms takes time. So even if the government began in earnest right now to drive such difficult reforms, there are pressures in prisons and in hospitals which cannot wait to be resolved. In these services, the cycle is at its peak and the Chancellor's options are limited to one, putting more cash in now. In adult social care and schools, the government has already made an emergency cash injection. But it needs an immediate answer to the question of what comes after the money runs out. Otherwise, we'll see the cycle repeat again. There's another group, neighbourhood services, the police and UKVI, in which we have seen signs of substantial efficiencies, but where the government and the public need more information to make a coherent decision about what comes next. And finally, there are two services where the government appears to have avoided its reactive cycle, in GPs and in criminal courts, and it needs to track their performance to make sure they stay that way. Now, you can read more information about all of these services in the report, and I'm just going to give you a flavour of what we found. So the number of prisoners has remained fairly flat over the last 7 years, while the number of prison officers has fallen by around a quarter. And for the first few years, prisons appeared to have coped with this situation. But they're now in the midst of a serious operational crisis, with violence continuing to spiral upwards and prisoner numbers set to rise more than was originally forecast. Now, the MOJ announced new figures today showing progress on the recruitment of prison officers. This is good news. Prisons need to recruit and retain officers as a matter of urgency. The pressures on hospitals are not quite at that level, but here the Chancellor actually has even less room for manoeuvre. Hospitals are set to continue running a deficit. But perhaps most worryingly, there's little sign that these overspends are leading to service improvements in the key pressure points. A&E departments are no closer to meeting their 4-hour waiting times target. And the latest data shows 3.9 million people waiting for non-urgent treatments, the highest the waiting list has been for a decade. Meanwhile, demand continues to rise. Emergency admissions via A&E have risen around 30% since 2009, and they're still going up. Now, it's too late for the government to do anything about this coming winter. But next winter, and the winter after that, and the winter after that, we'll see the same pattern repeat again if the government doesn't do something new to make good on the promises of the sustainability and transformation plans. Now, when the government announced an extra £2 billion for adult social care in the spring budget, they also promised a green paper to address the long-term questions around the funding and delivery of the service. Spending on social care actually fell through most of the last 7 years, starting to tick up following a transfer of cash from the Better Care Fund. This is despite an ageing population and growing numbers of people with long-term conditions. But the Green Paper has now apparently been kicked into the new year and downgraded to a consultation. Of course, as the so-called dementia tax debacle demonstrated, it's right that the government isn't rushing into any big changes in this area. But by failing to even begin the process, they haven't given themselves enough time to get reforms in place before the £2 billion runs out. That means they need to start work on their medium-term plan right now. In schools, the catalyst for spending was more political than operational. Schools haven't faced the same level of spending or demand pressures that we've seen in other services. So pupil-teacher ratios, for example, have stayed pretty much constant in primary and secondary. And pupil attainment data suggests that standards have remained broadly flat. Now, this year saw fierce debate over plans for a new allocation of schools' funding, which would have seen some schools lose substantial chunks of their budget. This policy is still being implemented, but it didn't survive the election campaign in its original form. An extra £1.3 billion has been found from elsewhere in DfE's budget to soften the blow, but only for 2 years. So rather than attempt to win the argument over whether some schools could manage with less money, or decisively admitting defeat, the government set itself up to have the same argument again in 2 years' time. Before that point is reached, the government needs to either demonstrate convincingly how some schools can manage with less, or accept that budgets will have to be rethought. So in these 4 services, there is an immediate imperative for government to act right now, whether that's injecting more money or clarifying a medium-term plan. In some of the other services, the level of imperative is less clear because the state of the service is less clear. This is particularly the case in neighbourhood services, which have absorbed large budget reductions over the last 7 years, but aren't showing the same signs of immediate distress which we've seen elsewhere. But that may well be because the national level performance data simply isn't there. Now, the reduction in the number of police officers in recent years is a well-known phenomenon. There are currently over 20,000 fewer police officers than there were in 2009. And there are signs that morale has suffered. There were nearly 500 more police officers on long-term sick leave in March this year than in March 2013, although we have seen a slight improvement in the last year. Now, there's growing political pressure on the government to increase the number of police officers, prompted in part, of course, by the spate of terrorist attacks in recent months. And there are other new demand pressures, particularly around cybercrime. The data suggests that police officers' workload is increasing, but it's by no means clear that increasing the number of police officers is the best response to the demand pressures for these new types of crime. The government needs to lay out clearly the evidence base for how and by whom it believes these types of crimes can be most effectively tackled to broaden the public debate. Now, we've also included UK visas and immigration in this category. This is the Directorate of the Home Office, which deals with the application element of immigration, not with enforcement. UKVI used to get around 20,000 applications every quarter from EU nationals seeking documentation to certify their right to permanent residency in the UK. This started to creep up, as you can see, at the beginning of 2016, peaking at around 125,000 at the beginning of this year, before falling back down again. That's when the Home Office added a note to their website discouraging people from applying until the new system was in place. Now, our analysis suggests that UK visas and immigration has managed this post-referendum surge in workload without a correspondingly large rise in staff numbers or a notable fall in service quality. The Home Office aims to process applications it deems straightforward within 6 months, and we can see that it's continued to manage that over 98% of the time. Now, of course, when I say that quality hasn't got notably worse, that doesn't mean it was good to start off with. Over the course of 2016, over 50,000 applications, I think that's around 18% of the total, were deemed not straightforward, so didn't count towards this measure, and we don't know how long those 50,000 people were left waiting. Existing problems remain. Around 40% of immigration appeals against the Home Office are granted. And of course, the challenge which lies ahead is on a different scale. If it started processing them immediately, UK visas and immigration would have to process 3 times the application it received at its peak every single quarter between now and March 2019 in order to get through all 3 million UK nationals believed to be resident in the UK. To manage this level of demand, UKVI is going to have to fundamentally reform their processes, and we will be tracking the progress of these efforts. And finally, it's not all doom and gloom. In GPs and criminal courts, while there are some signs of pressure, particularly around the GP workforce, the government has invested in reform before problems reached a tipping point. Its task is now to monitor the progress of these reforms, which we will continue to do in the coming years. Now, you can read more detail about these and all the other services in our report. But here's the point I want to leave you with. Only 4 out of our 9 services are in our top 2 boxes, where we have identified an immediate imperative for the government to act. But that's still 4 too many. No government should be faced with an imperative to act unless there's a natural disaster or a similarly unpredictable event. And a single set of good decisions in this budget, even if the Chancellor does everything we're asking him to do, won't stop this from happening again. The government needs to improve the way it makes spending decisions, tackling over-optimistic efficiency assumptions and making it easier to notice and respond to warning signs rather than crises. That's why we're calling on government to create their own performance tracker, so the Chancellor can make informed decisions about public spending and respond to warning signs. They should publish that tracker, or at least publish the assumptions which underpin their spending decisions. Now, we're expecting the results of the independent Barber review of government efficiency soon, which should go some way towards beginning this process. But efficiency reviews have come and gone in the past. Independent scrutiny of the decisions that government makes and the assumptions underpinning them is a key part of ensuring that government works effectively. If the Chancellor really wants sound financial management to be his legacy, he should be thinking about creating something more enduring, something like an OBR for public spending. Now, a lot of commentary about this budget will be focusing on the immediate issues in the headlines and what this guy is going to do about them. But we think you should be paying closer attention to this stuff, to how much effort the Chancellor is making, with the backing, of course, of his cabinet colleagues, to tackle the difficult problems which are liable to cause them pain further down the road. Their seriousness on these long-term issues might just reveal how confident they are that they're going to make it to 2022. Thank you.
Thank you, Emily. I'm delighted to be joined by Nicky Morgan, who is, of course, Chair of the Treasury Select Committee and formerly in charge of various things inside government. Delighted to have you here, Nicky. And I wonder if you might give some thoughts and responses to the report and more generally about how you see the Select Committee taking things forward.
Well, of course, and good afternoon, ladies and gentlemen. Apologies for being late. And it's a fascinating report, and thank you very much indeed for sharing the conclusions with us. I'm here obviously as the new head of the Treasury Select Committee, but also as a former Secretary of State for Education, so I paid particular close attention to the chapter on schools and education spending. But I'm also here as a constituency member of Parliament, because looking out across this audience, my worry with all these things is that it's great to discuss them here in London and close to Whitehall, but actually who in this audience and who here watching actually has to go and explain them on the doorsteps to those who are consumers of those public services, but also who are taxpayers who are paying for those public services and working extremely hard to do so. So I don't think we should lose sight of that perspective. Now, we know the government is facing mounting fiscal pressures, and the report obviously focuses on spending on public services, but you could equally look at the spending on welfare services as well, and a performance tracker on those would be obviously helpful. Now, the Treasury Select Committee is going to be looking at household finances. That's one of the changes that I've said. Obviously, the Select Committee has often looked particularly at financial services regulation, at banking, and obviously does the regular pre-appointment scrutiny and scrutiny of people like the Governor of the Bank of England and the Chancellor. But I'm very keen to unpick what's really happening in the economy for households, household debt, household saving, and of course what's happening in terms of, paying those taxes and reliance on the effectiveness of public services, because that's how people measure, I think, how a government is doing. And it was very noticeable this year that obviously in the general election we moved on very quickly from the big issue of Brexit, which I'm afraid I will return to at the end of my remarks, to social care spending, for example, as well as school funding, which is obviously a huge issue on the doorsteps in the election. Now, how acutely those spending pressures are felt in government will depend, as it always does, on economic performance. If the economy outperforms expectations, then chancellors obviously have more headroom to spend more money while meeting their fiscal targets. If the economy underperforms, then of course they're going to be faced with the difficult choice of raising taxes or borrowing more, or of course cutting public spending. Now, the OBR's latest assessment of productivity indicates that the Chancellor is unlikely to get an early Christmas present from their budget forecast, but we wait to see obviously what is unveiled around the 22nd of November. But I think that the IFG's conclusion that irrespective of the economic weather, this reactive approach is misconceived is a really good conclusion and very useful conclusion, and a good challenge for Whitehall to have reached. Because it does highlight, the report, a failure to plan spending in a way that reflects how and what we want public services to deliver in the long term. And I think it also needs to harness, I think it does, an appetite for change in the country, which was one of the reasons that drove the June 2016 referendum result, a realisation actually things are not working in the way that many people want them to. But as I said, things like social care, which undoubtedly need to be tackled, there also has to first of all be an understanding of the way the current system works. And having spent a lot of time in May and June explaining this, actually, it was clear there was a basic misunderstanding of the way the current social care system works, the funding and support that is available to households, but also what needs to change to make the system sustainable. Now, obviously, the report has 100 builds on 100 data series, it has 50 charts, so it really makes a very admirable attempt to quantify and analyse what the public services are delivering and how well they provide it. But of course, that in itself highlights something, which is it's easy or easier to measure spending and to measure inputs, but measuring the outputs is of course much harder. And of course, it takes time from putting money into the system, if that's what's decided to do, to seeing what happens at the end of the process. So I was particularly interested in the schools section on looking at the Key Stage 2 and Key Stage 4 results, because of course there have been changes. It's not just about spending, there have been other changes around curriculum, around teacher recruitment that feed through into those changes. And of course, output can be measured in different ways. I was just thinking, as I came in, Emily, I think you were talking about the better care funding. Now, of course, you're right, the money has gone in, and I think it's helped in terms of getting different arms of the state talking to each other, in this case, NHS and local authorities. But I can tell you from a Leicestershire point of view, what I'm now seeing is that as the squeeze on NHS spending continues, actually what's happening is the parties are falling out with each other about who spends what, and we've seen this in stories about bed blocking and spending on social care and everything else. So there's a bit of a dispute going on between the NHS and local authorities, because the NHS see that money and they'd like to have it back, please, in order to help them deal with expected winter pressures. But I think the other conclusion that the report reaches about the Treasury having a better use of data and analysis to plan public spending is absolutely right. And as a former Secretary of State, I think one of the issues was always getting both accurate data, but then having it well interpreted in the departments to drive future policy decisions, but also future spending decisions. So I think there's no doubt that the Treasury could have analysed further efficiencies in certain public services instead of waiting for, as you said, potential crisis points. Now, the report also recommends an OBR for public spending. We used to have this about let's take politics out of the NHS and out of education, which sounds good in practice until it's made very clear by those in the system and others, parents and patients, for example, that they do want somebody to appear at the House of Commons dispatch box and explain what went wrong. And if you agree that that's going to happen, we had this debate around the NHS Act right back at the start of the coalition government, when opposition parties in particular were making it clear they wanted the Secretary of State to be hugely involved in the NHS. You immediately bring the politics straight back into it. And of course, I think one of the things the report can't do, in a way shouldn't do, but is to reflect what the politicians have to do, is to then add on the political realities of the way that spending decisions are made. But of course, what the report does, and I welcome as now a chair of a select committee, is it gives us more information to be able to quiz the Chancellor and ministers and others about when they appear before us. We will obviously, as a select committee, be scrutinising the autumn budget and be asking the questions of the Chancellor and many other bodies about that, including the OBR. Finally, I just want to end with, obviously, there is another short-term spending well, perhaps not so short-term spending commitment, which is our exit from the EU. The Chancellor and the Prime Minister both made it clear last week that the government has already set aside £250 million to begin to prepare for contingencies in case we obviously leave with no deal. But also we know we're going to have to make changes to things like customs services as well, and we as a Select Committee have quizzed HMRC already about that. But of course, one of the questions, and maybe it'll be picked up in next year's report, is how the spending on our exit from the EU actually is looking in practice, and how effective it actually is in terms of the input and what we're seeing for that money. So thank you very much. It's always useful to have more data and more information, and a great pleasure to be here today.
Great, thank you, Nicky. I'm sure we'll come back to various of the points you've raised there as we move to question and answer. Gillian, do you want to just pick up on some of the aspects of the report, and also, you know, there are many other governments who face these sort of things and other things going on that you see in your role in CIPFA. Some thoughts for us?
Absolutely. Well, before I start, I'd just like to say, you know, congratulations to the team involved in writing this report. It's an excellent report, and, you know, it's an independent, evidence-based report outside of government and Parliament, addressing financial and non-financial information. In terms of this week, I just want to draw upon a couple of experiences this week that relate to the report. Earlier this week, I was talking to a group of international visitors from public accounts committees, and the talk was about the common obstacles to public spending. So, in other words, why don't we actually get the outcomes that we desire? And I rattled off the usual sort of suspects, you know, poor procurement practices, waste, bad financial management, poor governance. And I actually thought, well, efficiencies, thinking about the relentless push on public services to achieve efficiencies, mean that in some instances, public services are really sort of at the tipping point in many cases. And I think that's highlighted in the report. So that was the first related event. The second related event was this morning, where I was due to talk on Talk Radio about the report, and I was actually dumped because Brexit and the amount of debt that we need to pay was going to be the theme of today. Well, I would have thought that the public would be more interested in knowing about how their services are performing, and that would have been much more sort of engaging debate. So there we go in terms of two instances there. I think it's fair to say we have known for some time that the public sector has faced mounting resource pressures, even before the 2010 spending review. So successive governments have tried to instill an efficiency culture throughout public services. So if you go back to, I think it was around 2003-04, you had the Gillian review, which was a push on efficiencies mainly in the back office, for the back office functions such as finance, human resources, IT, etc. But at that time, there was a mandate really not to touch frontline services. And I think this report shows that there's been a real shift there in relation to achieving efficiencies. As Emily said, quite rightly said, I mean, although austerity provides a backdrop to the report, it's not the case in all of the services. So all of the services haven't received the same cut in spending as, you know, it hasn't been right across the board. But for me, the report raises a number of key challenges and questions, and some of these are actually highlighted in there, in terms of how can we break away from short-termism, how can we break away from the short-term political cycle in relation to making policy and planning decisions going forward. So how can we build in medium-term policy and financial planning making, and the longer-term policy making too. We seem to be, what's already been said, in relation to moving from a crisis to cash to repeat crisis cash sort of environment, and we really need to move away from that. And I think the short-term political cycle doesn't help in that way. But also, it was never the purpose of the report to highlight what the policy plan should look like or be, but there's a real absence there. I get no sense of what are the big plans for tackling service areas such as adult and health services going forward. Really no sense of that throughout the report. And how are we going to establish and ensure sustainable public services going forward where the funding streams match service delivery? These are all big questions for government and the Chancellor going forward. And indeed, how can we squeeze any more out of the system? Is digitalisation going to work? Is transformational change going to work? What is it going to look like in the future? Now, Emily knows this, and we've talked about this as we went through the report. My desire was to have a risk register there, and actually, if you go through the report, looking at amber, yellow and green, you could probably attach those against the 9 service areas that are outlined in the report, but she wouldn't let me have that. Yeah, she was controller. But again, having the what's not quite in the report, it is in a few instances, but what are the mitigating factors against those risks going forward? Maybe she'll have it in the next report, perhaps for Brexit. Who knows? Anyway, so in terms of, just to really sort of conclude, I mean, the strengths of this report are really in terms of whether the recommendations are taken forward into the existing efficiency review by government and indeed by Parliament. I mean, the Parliamentary Select Committees should be using and taking this report as they undertake their departmental scrutiny reviews, be using it to hold government departments to account. So the real strength is there. And from a CIPFA perspective, we of course have a number of our members, professionally qualified accountants, working in and across central government and public services more generally. In terms of, they have been working in a different environment, a resource-constrained environment, and they're faced with having to pull rabbits out of hats, and it's a question of how long they can go on to do that. But just to conclude, I would say, in terms of CIPFA and our members are here and are prepared to play their part. Thank you.
Thank you, Gillian. Great. Various themes coming up there. I mean, at the heart of this, as Nicky reminds us, we will never take the politics out of this. And I suppose one of the questions we have at the Institute is how do you help make that politics work a little bit better? How do you make sure that we're actually, I think in any spending review I've ever come across, ministers always make tough decisions. It's just, are they making the tough decisions that are actually really going to be the ones that affect the services? So I think that's one of the themes that we'll, I'm sure, want to pick up on. But I think also in the particular services, we try to draw out this sort of feeling across government and give, I think Emily was quite right to resist the slight sweeping generalisation of a RAG rating across the complexity of these. But we have sort of drawn out and highlighted particular ones and others where actually I think I had conversations with people where they've been quite surprised. And actually the coverage of this report, it's often the ones where we're saying it's not actually that bad, which tends to be the message that gets completely lost in the coverage. So again, a sort of theme about how this helps and plays. But I just wanted to throw it open now to people for questions, comments and thoughts that people have in this room. Also, if anyone's in next door, if you want to pop through, I'll take questions from there as well. But who wants to kick us off? Excellent. Start with gentleman just behind. Yep, and then come forward to you.
Very interested in the idea of an OBR for public services. The idea has...
could you just say who you are? Sorry.
I'm Christopher Hood. I led a research program on public services in the 2000s in which we looked at very much the same kind of data that we've heard about today. I think the idea of an OBR for public services is a very interesting one, but I wonder if the speakers would agree that any such institution would be sitting right on the San Andreas fault of British politics. And how exactly, clever politicians as you are you going to construct such a machine? Thank you.
Okay, thanks, Christopher. And then come to David.
David Walker, Guardian Public Contributing Editor. Any sense from the panel of the contours under those service aggregates of what's happening to the process of provision, specifically outsourcing, given that outsourcing has now become more politicised because of commitments made by, rhetorically at least, by the Labour Party? Any sense of how far those service profiles have moved either against the outsourcing of services or, as some evidence suggests, particularly the health service, actually increasing?
Okay, thank you. And then I think there was a question just over there.
Andrew Hudson, now a serial non-exec but Director Public Services in the Treasury 2009 to 2011. So since then, you talked about the 2010 spending review and not then leading to transformation. Interested, and it may bear on David's question on the trajectories, that since 2010, some services are doing not too bad, as Gillian just said. Others that had similar levels of cuts are in serious trouble. And how far is that because transformation was tried and failed, or wasn't tried, or because demand has gone up, or because something else has gone wrong in the ones that are now in serious difficulty?
Excellent, thank you. Right, Emily, do you want to start off with some of those questions? OBR for spend, how's it going to survive the...
Yeah, so I mean, let's be clear. Our suggestion is for an OBR for public spending, which is not the same thing as an OBR for public services. And so, what we specifically think that this organisation or an organisation needs to do is scrutinise the assumptions which underpin spending decisions. So, you know, when allocations are made to services, within them are baked in assumptions about how far efficiencies can be delivered. Okay, for how little money can this level of demand be met? And you know, as we've kind of argued last time, there is of course a really strong temptation for optimism to get worked into these assumptions. Not in any great way. It's the accumulation of small assumptions which might be defensible on their own, but when you put them all together, become something that kind of isn't realistic. So, you know, for us, the job of the OBR for public spending is to say simply, are the assumptions on which you've based your decision going to allow you to do what you say you're going to do? That's something slightly different, I think, from kind of saying, what should you do, which is, of course, a political question. So I think that might kind of, you know, circumvent some of that.
That's great. Nicky, do you want to pick up on any of those, but particularly your sort of sense of what happened, why they do it with transformation?
Well, it's very interesting, and I think your point, as you said, you know, you're never going to get rid of the politics, and you're never going to get rid of unexpected circumstances. So it's very hard to do the forecasting, and I think in terms of transformation, I was just thinking about so some of the spending decisions that we made in terms of the 2015 spending review, obviously were predicated on the basis of we knew we were preparing the white paper that was published in March 2016 about the whole school system, and you know, what we were going to do in terms of more schools that became academies, more multi-academy trusts, looking at the funding formula, and then of course politics got in the way in the form of the EU referendum, change of government, and completely different sets of decisions made. But you've already baked into that point some of the spending decisions, and then actually the politics changes. So I suspect that's partly to do with transformation. The other thing is of course the knock-on effect of changing other services. So I haven't been in the Justice Department, but there's also been lots of talk about rehabilitation and the changes according to that. But then actually you've got to I suspect, look at what's going to happen in terms of the demand for prison places, demand for alternative provision education, so how many people are you keeping out of prison, you know, all of that. And I think, going back to Julian's challenge, what can, you know, organisations like the IFG do? Actually highlighting these issues and creating a public pressure which politicians have to respond to, and also pointing out, I mean, you will know if you've been in the Treasury, I mean, government exists in silos, and getting, ministers are better about talking to each other, but actually getting departments to talk to each other and work out. So again, you know, the challenges of, I was thinking about this as coming over, so I had a email from a constituent this morning about the cost of school transport. So actually for households, what's happened is, obviously local government budgets, have been undoubtedly squeezed. So they've then made decisions about what they aren't required to fund. Therefore, that means that the costs of transport are now put onto households. So that then has a knock-on effect on household spending. Was that factored in when we were thinking about spending on schools and the councils were thinking about spending on local government services? Probably not to that degree.
Okay, thank you. Gillian.
On the question of the OBR, rather than create a new body, I'd sort of want to see an expansion of the existing body's remit into this area. But we do know what happens when you mix politics with reporting on policy performance, thinking about the Audit Commission and what happened to it in terms of mixing the two there. So I think caution has to be taken. In terms of the profile on procurement, that has changed significantly over the past few decades, as you're probably aware. So if you're thinking about it, it's about a third of public spending. Public spending is about 730 odd billion pounds a year, and about a third of that is on procurement. And if I think back to when I was an auditor a long time ago, but if you looked at a typical sort of local authority, 80% of its spending would be more or less staffing. Now, that's considerably reduced. You'll find around about 56% in most authorities is spent on commissioning of services. But also, of course, what you don't have there is where the money spent in public services is subject to value for money audits. It's not the same case for the procured services that are commissioned out. So they haven't got to undergo a value for money audit the same as its public sector counterparts, even though they're delivering public services.
Excellent, thank you. And actually, Andrew, just on your point, and because you, of course, were responsible for the 2010 spending review, which we're fairly positive about. I think the underlying thing that I think actually I would say comes out is why do some services do better? I suspect it's largely to do with the amount of inefficiency they started out with. I think our mechanisms took out quite a lot of inefficiency. Whether they were capable of truly driving sustained, transformed efficiency, I think is the real question going forward.
I don't disagree. I'm sure those running those services would, if they were in the room with us, would each take a different view. But I see what you're saying.
I think it's a broad generalisation. Having stopped rag rating, I've just introduced broad generalisations. Yes, we'll let the questions start here and then take two at the back.
Simon Judge, Government Finance Function and a member of CIPFA. Slightly nerdy question for you, Nicky. I wonder if you have any thoughts about how select committees are going to work together with this new role that you envisage for your committee. I think quite a positive development over the last few years has been getting departmental select committees to look at issues that previously they just left to the PAC. It's all to do with the accounts and VFM, etc. I think is there a risk with your interest in those issues that they will say, oh well, the Treasury Select Committee will look at how good planning is across the system. We don't need to worry about it anymore.
That's great, thank you. And then, yeah.
Hi, Duncan Chobsall. I work for a grant-making trust, but I previously worked in central and local government. Three very quick points. First, on the OBR, it would have to be better at its forecast than the current OBR, having discovered it didn't calculate productivity right. So that's a challenge. All forecasts are potentially flawed. Second point, the issue about demand. So the two services you've highlighted in real crisis are prisons and hospitals, and they're where people end up when everything else goes wrong. So your mental health services and everything else goes wrong, you end up in prison, and hospitals you end up in wrong when everything preventative has gone wrong. So that's also a sense that if you're cutting everywhere else, you shouldn't cut in the services that pick up the slack. So yes, you can try and do things better, but all end up there. Thirdly, particularly because you've got CIPFA on the panel, you didn't really pick up who's making the spending reductions. So having worked in central and local government has its flaws, but is usually better at managing in the round spending reductions and the trade-offs than central government ever is. And I just wondered if you might pick up that a bit more, because your neighbourhood services and police, they're definitely under pressure, but the way they manage in an area and they see the trade-offs is different to a siloed central government department. So bring out that more. And obviously we've got new bits of landscape, metro mayors, particularly what's going on in Manchester, which might be able to do some of this better planning in the round than central government ever can.
Excellent, thank you. Very good set of questions. And then, down there.
Thank you. Leon Feinstein, Children's Commissioner's Office. Just a question about the quality of measurement, and particularly the measurement of the quality of services, because it seems to me quite frustrating that, for example, in relation to education, we're seeing a level, a flat trend in terms of key stage scores, but of course what's happening to the well-being and welfare of children, about which we know very little, and where a lot of the consequences of service reductions will be felt. So I just wondered if you had a view on the degree to which we've improved the capacity to really get at meaningful efficiency. Thank you.
Excellent, thank you. Emily, again, do you want to kick off?
Yeah, on quality of measurement, I mean, our model focuses very much on inputs to outputs. So we don't look at outcomes because we're kind of trying to match spending to what then happens in the service rather than what then happens in the world, because of course there's lots of things that can affect that. But I mean, on quality of measurement, there are some really basic things that we don't have. You'll have a look in the neighbourhood services chapter. That was a particular challenge for various reasons. I mean, the number of GP consultations that take place is not data that's in the public domain. So there's some kind of really basic things. Actually, GPs is one in particular where there's some kind of quite basic quality measures that that we would have in other services that we don't have. And so I would think, yes, the quality of measurement is going to, it shapes what you're interested in, and what you're interested in shapes what you measure, and it's important to be reflective about those things and think about the measures that you have. But I think there's also a step prior to that, which is getting some really basic data in place that isn't there at the moment.
Excellent. Nicky, you had Simon was asking you a direct question on that, but pick up on the other points as well.
So obviously departmental set committees do work together on actually, we're seeing more of it, and we're also very conscious about trying not to tread on each other's toes. So yesterday the Treasury Set Committee launched our inquiry on student loans, but we're trying to confine ourselves very much to the impact on public finances, what's happening in terms of the numbers, rather than looking at the overall policy towards the funding of higher education, although inevitably it's quite difficult not to stray into to that territory. And I think that the PAC, knowing Meg as the chairwoman that she is, she will absolutely continue to look at how money's been spent and the work of the NAO and others. And you're right, say the Treasury, I mean, one of the things, the joys of being a Treasury Select Committee chair, but also the challenges, is that frankly we could look into almost anything, because the Treasury's, as I know as a former Treasury Minister, the Treasury's fingers are in every pie. But we are, again, trying to confine ourselves to areas where we can make a real difference, and others we would be sitting every day between now and Christmas 20 whenever. So we will. But those links between the committees are very strong in terms of working out what others are doing in terms of workload. I just want to come back on a couple of other points because I think are really interesting. I think on the preventative and how that works, you're absolutely right to say that clearly, you mentioned prisons and hospitals and I would say the police as well, actually, in terms of as a local member of Parliament. When other services aren't stepping in, particularly in terms of mental health crisis, it's often the police that are the ones that get called to deal with that. But my challenge, and I throw this out there really, is again as a local member of Parliament, I see that commissioning, I'd be interested perhaps in Gillian's point of view on this, commissioning practices, and perhaps it's the drive for value for money, but there are lots of small local services, often in the third sector, who could offer brilliant preventative support for actually not a huge amount of money, but for whatever reason, I don't think they even get onto the commissioning frameworks, if you like, in terms of being able to bid for it, filling in forms. I know, as a trustee and director of a very small mental health charity, that there are things that we have just said we just can't do because the time involved in bidding for something just is not worth it, and it would take us away from our core mission. And I think you're right to mention devolution as well. It's kind of gone slightly off the boil since George Osborne left the Treasury, but it's still obviously happening with our mayors and Andy Burnham and Andy Street, and how that's going to impact on things and how they are taking on obviously responsibility for Manchester, obviously in terms of their work in the NHS, for example, which is a whole new area. And just finally, the measurement, the quality of services, and particularly in education. And obviously well-being is something that, given my book, my character education book, something very close to my heart. And looking at those Key Stage 2 results, I mean, it's interesting, Key Stage 2 and Key Stage 4. Key Stage 2 obviously beginning to see a bit of an uptick. Let's see whether that's sustained. I think it will be. But obviously, Key Stage 4, it takes a long time, for kids to work their way right the way through the school system into GCSEs. So in a way, you're not, it's difficult to measure because you want to come back and look at what the Key Stage 2 2 children now, or in the last couple of years, how do they do at Key Stage 4, in a few years' time? But one of the things I have worked out, I think on well-being, again, it's very difficult. There's been calls for a general well-being measure, and I think that's really interesting work to look at. I have to say, greeted with massive cynicism by elements of our commentariat when it was suggested. Goes back to your point about the bad news always gets reported, not the good. So we need to push back on that, those of us who are interested. I do think on character, I was asked just this morning, can you measure it? Well, the answer is, do we want to measure it? Or do we actually use other measures, which is what the schools tend to do, that I interviewed for the book, in terms of absenteeism, all sorts of participation in extracurricular activities. But ultimately, isn't the test as a society, are we getting young people out of our education system who are ready for the world of further study, the world of apprenticeships, and the world of work? So again, how do you measure that? But as I say in the book, Whitehall likes what gets measured gets done. Sometimes we should say, should we be measuring this, or should we just do it anyway, going back to preventative work?
Excellent. Gillian, you had a particular CIPFA.
On the spending reductions, well, again, I don't really want to generalise on this, whether local government do it better than central government. So, for example, CIPFA at the moment are undertaking a number of financial resilience reviews, for example, with local authorities, which doesn't suggest that they're any better. So all I would say in terms of local government have probably been doing it longer, a lot longer. But certainly in terms of, I think with the public sector, there is a problem where local government, central government, health work in silos to some extent, and they don't share best practice in terms of around these areas. And I think there needs to be much more of that going forward. And can I just say something on select committees? I used to support select committees quite a while ago, but I don't think I ever came across an instance where a departmental select committee would cover exactly the same ground as the PAC or indeed the Treasury committee. And every departmental select committee has a responsibility, as you well know, to review a government department's performance every parliamentary cycle, looking at its, the value for money elements and the financial elements too. And that was one of my jobs, to support parliamentarians to help them do that.
Excellent. Great. Okay. And just on, there was a comment about OBR's forecasting. Duncan, I think, was having to speak on behalf of Robert Choate. I think his answer would be something along the lines of, actually, the OBR produces a model. It can check whether it worked or not, and we can have a rational discussion on that. And I suppose that's at the heart of something we're saying about the OBR for public spending. Let's get a model. Let's get something which can work or not work, and you can go back and refine it. Whereas at the moment, each review has its own set of assumptions and data chucked in, which is actually very difficult to learn of. Do other people who want to sort of come in now? I'll just start right at the front here and then go across there and then there, so I keep on running.
Thank you. Tim Harford from the Financial Times. Could you explain a little bit more, Dr. Andrews, about the connection between the starting point of your presentation and the end points? You started by saying that government was very reactive, waited for things to blow up before responding, wasn't planning well enough. It seems plausible. The solution you propose is this transparent, independent scrutiny of assumptions. It also seems plausible, but I can't quite follow the connection between the starting point and the end point. Is it that you think that the fundamental reason why government is crisis-driven is that planning assumptions are not being scrutinised? Or is it something else? And if it's something else, what can we do about it?
Okay, excellent question.
Martin Wheatley, advisor and researcher on public services, of particular interest in social housing. This question or comment really about what I see as a growing public conversation and political interest in the low-income and vulnerable part of the population, which I think we've seen with in reaction to Grenfell Tower and the current controversy about universal credit and so on. And I just wonder whether this sort of analysis would be strengthened if there were a data set looking specifically at the performance of public services in relation to low-income and vulnerable people. Because obviously, if public services are not working effectively, that will tend to have a particularly acute effect on households that are particularly dependent on those services compared with the rest of us.
Great, thank you. And then final question for dispatch, just over there, Richard.
Hi there. And it's a sort of comment, Gillian. It's Richard Douglas, who's one of the authors of the report. He was really coming back on this local central issue, which I think is a really important one. And I think part of the key thing is that the initial spending reductions, you go back to 2010, there was quite a deliberate effort, and I was a finance director in Whitehall at the time, to actually push those decisions out to local bodies, whether they're local authorities, whether they're local NHS bodies, local schools. And it was for a combination of good reasons and bad reasons. The good reasons were people locally actually were far better placed to make decisions than someone sat in Whitehall. The bad reason, I guess, was it really distanced Whitehall and Westminster from what was being done out there. And one of the things I think we've come through as we've gone through this report is this ability to push every decision down to that local level to make savings is sort of running out of steam a little bit. And if you're going to do things that are truly transformational, you need some national leadership and national direction for that. You can't just leave it to people out there. And I think that's the balance that changed probably and tipped in the sort of later part of the 2010 spending review. So it was a comment rather than a question.
That's excellent, very useful. Great. Nicky, do you want to open up on possibly picking up on the vulnerable workers, Martin's point?
Well, I think fascinating how it's done and what the data sets are and everything else would be, great. I think you've given the IFG some more work to do. But you're right. I mean, obviously there is a growing conversation. I think particularly around the debate has perhaps until most recently been all about getting people into work, and now of course lots of people are, given the employment figures, in work, but what's that doing and what security is that providing? I think there's also a wider debate about the kind of values we have as a country, and I think that Grenfell Tower, the tragedy that unfolded, that opened up that wider debate. So yes, I think just from an education point of view, I mean obviously we have things like pupil premium, and specific support for 2-year-olds from disadvantaged families. I think there is a lot of work about analysing how effective are those is that spending and those programmes. But of course more always can be done. So I'd be very interested to know what would be the best way of measuring that, the more information we have. I just want to pick up also about data. I just thought it was really interesting that Emily's your point about data sets and what's lacking. And actually we used to have this debate in, obviously in the Department of Education about the data that was being put out there and what is, and I think it would be really useful actually for ministers. I don't think ministers necessarily always are made aware of the requests for data and what's available and what isn't. It's a side of being a minister that apart from we get, really that sort of admin side of things is just not very obvious to us as ministers, apart from when you get something like an FOI request where you're asked to judge, that's tricky, that you make decisions, but that's obviously very, very different. So I think that would be interesting to know.
Excellent. Emily, do you want to come back? I think Tim in particular had a specific request for piecing the logic together.
It was a really good challenge. So politicians react to crisis, and politicians don't want to react to crisis. They don't want to get into crisis. But they also want civil servants to tell them that they can manage the spending reductions that they want to do and it'll all be fine. And that's the kind of, and it's, through that process, again, not deliberately, but we see optimism bias starting to creep in. If you had an independent body telling them it won't be fine, and if you do this, your crisis is going to come, then you might get the same reaction to the possibility of a crisis before it happens as you would to an actual crisis when people have suffered. So that's my answer.
Got you. And I think we're not saying that that solves every problem in public
Indeed.
spending. There are other issues here,
Nothing
but
solves everything.
nothing solves every problem. But actually, I'm interested in going back to Nicky, because we're slightly taking politicians' names in vain on that one. But there are certain things that we see, and it probably follows on a little bit from Richard's question, and relates to what we were talking about with Andrew, that actually pushing stuff down, if you think there's inefficiency in the system, actually it's quite a good way of finding it. It's very difficult to find it from the centre. But transformation, some of the big politics of things like what are we going to do about social care? We've got a project coming up over the next year looking at how do you open up the long-term funding of the NHS and face of demographics. Issues that politics really hasn't yet really been able to get into. Are there ways, what can, obviously other people can open up the debate, but at the end of the day, how's our politics actually going to face up to some of these things? How do you think that will play?
Well, I think a lot of it depends on context, and I think you're right about other people, FG, think tanks and others can absolutely open up debates, and sometimes debates are opened up by events and circumstances. You say the crisis, if you like, happens unexpectedly, or suddenly the public pressure is ramped up about something in a way that nobody expected. I think that it is very difficult. I mean, social care is one of the issues. Certainly as a constituency member of Parliament, I identified about 12 months ago or so that there was a real issue with social care, not in terms of, I mean, there is an issue obviously in terms of provision and funding, but there's also an issue as a country that we have not thought about it hard enough. A bit like pensions, we all assume that it'll be fine when we get to the age of 65. And I had a lot of constituency cases where people would come to me and say, mum's had a fall, she's in hospital, dad has dementia, what do I do now? And there was no, so the question is, I suppose, what can we perhaps, first of all, we have to have the political sort of agreement this is an issue. I go back to sensible coverage about this and encouraging debate. And when people put ideas out, and you saw this to Jackie Doyle-Price the other day, her comments on, picked up from a party conference fringe meeting, actually she was putting something out there about the use of people's assets and homes when they get older. The hysteria ensues. How is that meant to encourage politicians and ministers to float ideas other than in the safety of their own offices when you have a briefing note from the civil service who are, by and large, actually, they do give you the options. And they will say this is what could happen in a few years' time on our assumptions. So we have got to get more grown up about having these issues and facing them down. And actually, this is the moment of the political cycle to do it. Because, I'm an optimist. I think this government is here for the long term, till 2022. So the social care thing, I think it teaches us don't make controversial announcements in manifesto launches. But now is the time to actually get people together and really think the hard things and question.
Excellent, thank you. Jim, was there anything you wanted to...
Just picking up on the sort of low-income group of people. Interesting in the report, if you got sort of towards the end, where we looked at neighbourhood services in local authorities, and I think we made the point there about the absence of data, really. So we really don't know how much they've been cut. So in important areas, such as some of the regulatory functions that they're responsible for. And generally, those are the areas that would touch upon vulnerable people. The other aspect which is related is around public satisfaction and opinion. So throughout the report, I think in most cases, it's sort of level. There's been no real significant drop in public opinion. But I just wonder, within that, who are we asking the questions of, and are we really getting to those vulnerable groups in terms of, of asking about their experiences of the services? So maybe that's something for the next performance tracker. Sorry, I'm already making a big list here.
Always keeps going. Excellent. Any more quick questions, comments? Lady at the front.
I'm Frankie Hackett from the National Audit Office. I just wanted to ask, where do you think that the major IT programmes that the government's currently in progress on fit in with this idea of the crisis cash cycle? Do you feel that there's a lot of reliance being placed on IT programmes? Is perhaps not enough being done in terms of digitisation? And will the IT programmes deliver what they are promising, I suppose?
Excellent, thank you.
Thanks. My name is Rupert Gill. I work for HMRC. My question actually is a bit about, since 2010, we've had a sort of fair chance to see what kind of things work and what kind of things don't work. So a couple of things have come up. So digitalisation is one. When we are thinking, right, we've got to think in advance about reform, what kind of reform should we be thinking about? Which ones have we learned much on that so far? So the early intervention agenda, particularly with disadvantaged kids in particular, has that. There's a bit of a drive in government to get really stuck into that territory. Is it now time to see whether that's worked or not? Other things are, some of the community budget sort of sharing responsibility across agencies. Nicky, you mentioned that's maybe coming under a lot of stress right now. But those which of those kind of initiatives, and the 2010 spending review did bring a lot of enthusiasm to try different things. You sort of forget a bit that actually wasn't just salami slicing. There was sort of some big ideas in the mix there. So do you have any reflections on which of those are sort of proving the front runners now?
Excellent, thank you. Emily, do you want to?
I can pick up on the IT point, although I'm afraid I can only say something quite general about it, which is that what we now know, now that government is trying, central government certainly, and there's kind of more of a move doing this elsewhere, of trying a kind of new approaches to IT. We're not calling it IT anymore, we're calling it digital, we're doing it much more iteratively, and kind of what the IFG has found in our work is that the problem is that the kind of the way that government organisations are set up is fundamentally kind of at odds with the way that developing IT programs in that way needs to work. And so, I would say that there's something, that's why people call it digital transformation, is that actually it's not because kind of tech is so transformational, it's because you do actually have to change an organisation in order to make that stuff work, and that's tough. So.
Excellent. Nicky, do you want to?
Well, what I can tell you is that as a minister, when somebody mentions a large IT project, you look scared. Obviously there are some projects. There are some digitalisation and moving into the 21st century. It's just essential. There are some IT systems that just have to be replaced. And obviously we questioned HMRC about customs and preparedness. And whatever happens in March 2019, then we're going to have a new. There is a new customs system coming anyway, and it's clearly going to have to be enhanced in order to deal with more customs declarations. And there's obviously, I suppose the other thing I was going to say is, we've also got to remember all this, and I was going to say, you've got to remember real people are using all this, and I think that sometimes, it's very hard to build in that as an assumption. Actually, how are people going to use this system? I think actually gov.uk, there are many aspects of it that are excellent, and I can tell you as a minister, I would sit there and use it and see what was there and everything else. But of course, you've got different age groups and different expectations, and people are using non-government services, so things like childcare. Obviously there's been the issues over the summer. They will be resolved, but the question is people's expectations, particularly younger generation, of IT is very, very high now. So how does government keep up with that? In terms of transformation, and I think one of the things, I can't remember when they did it, but David Cameron and Nick Clegg launched that ideas website for people working in government and outside to submit ideas about how they thought, because actually the best people to ask for how things can be improved or done differently are the people who are working absolutely in the system at the moment. And I do wonder whether perhaps it's time to do that again. People have seen what's happened, and can we ask again what people would like to do differently, or 7 years down the line. I think for me, though, it is this cross-departmental working. I was just thinking about the question about the vulnerable families, and just thinking the other thing, of course, is that people don't live their lives in silos. And that was the thing about the troubled families. What it was trying to do was to bring together so people had one key person who could deal with all the other agencies, as opposed to lots of agencies piling in and trying to help one family. And again, what could be done? The cross-departmental working is going to have to be improved. That's got to come from the top. It's got to come from ministers and senior civil servants actually doing all of that, to show that it can be done better on the ground. And I go back to my example about young people's mental health, where actually you can see on the ground that schools and local GPs and CAM services want to work better together. Actually, there was an appetite amongst civil servants to talk to Department of Health and Department of Education working together, but it's keeping that on track.
Excellent, thank you.
I'm probably not the best person either to talk about IT, particularly given I was presenting to this international group earlier this week where I was reeling off a catalogue of IT failures in government. But that said, I mean, in terms of, the government has an industrial strategy which is really pushing the digitalisation agenda. I think that's probably right. I think that it doesn't apply to every single service, but from an accounting perspective, digitalisation, artificial intelligence is fundamentally going to change the way professional accountants work in the future, and that will include you in the National Audit Office as well as accountants working in and across government.
Excellent, thank you. Just one thing that was sort of striking me there in the sort of discussion. There's a lot of reforms that really depend on people having the time and space and energy to make them work. And you were mentioning in health, and I think we've picked this up a lot in the Institute, people just not, senior leaders, but also people working throughout the organisation, there just simply isn't the bandwidth to keep things moving when organisations get under so much stress, but also think about how you're going to transform and make them work. Rush digital implementation is an utter disaster, as read a few NAO and indeed IFG reports. So I wonder, this cycle is one of the most pernicious things about the cycle that we observe, that when something gets past a certain point, it becomes very hard to fix, especially if the fix needs to be transformatory. I don't know, panel, any thoughts on, what does that imply? Where do we see that most? What can we do to try and avoid these sort of cycles or to help people get through them?
I suppose the question I was thinking was, do you ever avoid the cycles? Maybe you can smooth them out a bit, but there's always going to be there's the ongoing business of government, and can you do that more efficiently? And then there will be the issues where clearly something is no longer fit for purpose, or it's just got to be updated. So I'm thinking about perhaps the curriculum in terms of schools, where frankly just the needs of employers and universities and others just changes. So you've got to update it. And then there is the transformation. Now, whether that's driven because of money, or whether that's driven, as I say, that because things like the industrial strategy is a really good example, where we've just got to work out how is the UK going to get itself onto the global stage and keep ourselves relevant in terms of new technologies, for example. And I think creating that brain space, and I think it's, the difficulty is, I think, just 21st century life and demands and the news cycle and everything else is just so much faster. And it's very hard to say, I just haven't had the time to focus, sufficiently on this, which is why it's going to take longer. I think there are more and more demands. Probably select committees and others can be guilty of this. When's it going to happen? And placing those expectations for delivery dates, and are they unreasonable delivery dates?
Excellent, thank you. Emily, any sort of thoughts wrapping up from the discussion we've been having? What do you think comes out of Performance Tracker? What do you reflect on from the discussion? Where do you think we're going next?
Okay, so I mean, and kind of like picking up on the question that you asked at the end. We haven't got a RAG rating, but we do have a spectrum. There is a clear spectrum in the report, and you'll see that they were actually kind of coloured slightly raggishly, my boxes. So it's crept in there, and so that and kind of within that, we do see examples where government has actually managed to react before that breaking point has happened. So we know that it's possible, right? And sticking plasters are a term that we refer to, that we kind of use quite derogatorily, right? We say sticking plaster injection, but the fact is a sticking plaster serves a purpose if you use it properly to actually do the healing that goes on underneath. And that's kind of actually, I think, the real challenge for government right now. Okay, this spending, fine, but I think the thing that probably most worries me is the lack of a clear medium-term plan for what comes after the sticking plaster gets ripped off, to kind of make sure that the healing's going on. And I think that's the thing I'm going to keep watching for.
Excellent. Gillian.
And for me, I think from the report, just going back to what I said at the beginning, is really sort of the absence of those big plans. How are we going to solve adult social care? The lack of the innovative thinking there, and that needs to happen, because obviously we're not just providing services for today, we're providing them 20 or 30 years hence, and they need to be sustainable. So if anything, I'd want to see more around that particular area.
Any final words, Nicky?
Well, I think obviously it's very helpful, and I think opportunities like this to stand back and to have external bodies, and I think it's really helpful that the IFG and others do provide that, sometimes that brain space, which actually I think when you are, particularly at the moment when Whitehall is challenged to deliver, as somebody described it, something I was at this morning, the biggest public policy project that we have seen for decades and decades and decades. And I think those working in Whitehall would agree that a lot of the oxygen is being sucked out of other departments in order to deliver Brexit. And that means that actually they're then, the reliance or the need for external challenge and external thinking, is ever more important.
Excellent, thank you all very much. And just to say a final bit, one of the things about Performance Tracker is we keep tracking. We have a little bit of a break. Hopefully the Treasury are moving, following a recommendation of ourselves, the IFS and the CIOT, to annual budgets. So our next Performance Tracker will come out in 12 months' time, when no doubt we will be seeing a turnaround in some of the areas we've been looking at, and a fully formed plan for the delivery of Brexit. But also, if you're reading Performance Tracker and you think there's a piece of data here that actually really should be in here, because it's the key thing to look at in the way we're working, please just do get in touch with us, because we really want to improve the quality of the product. It'd be even better if that data exists and you know where it is. But we'll take all comers on that. But with that said, just a chance to thank the panel very much for their contributions, and to wish you all well for the rest of the day.